Today I want to talk about the treatment of hepatitis B. A lot of people that have hepatitis B have not been properly treated. A lot of them that thought they have been fully treated, but the hepatitis B is still in their body causing a lot of damage. But before we talk about the treatment, you need to understand what is hepatitis B. Hepatitis B virus is one of the common viruses that causes problems with the liver. And this hepatitis B virus can lead to a lot of problems. You get hepatitis B virus from maybe sexual contact or from contact with the person that already has hepatitis B or by use of sharps that have not been sterilized properly. And also, a mother that has not been fully treated for hepatitis B is likely going to give her babies. So hepatitis B has led to a lot of problems that you see that most people in the villages, in the town have hepatitis B, and it has led to a lot of liver problems. Hepatitis B initially caused an acute infection in which you see somebody having yellowish discoloration of the eyes, his urine will be yellow, he will be having fever, abdominal pain. But the good thing is that most people that have the acute infection of hepatitis B recover from it fully without it progressing. But unfortunately, about 10% of people that had acute infection of hepatitis B will progress to have chronic hepatitis B. But at the level of chronic hepatitis B, it can also be properly treated. But if it's not treated, it can progress to liver cirrhosis. And at the level of liver cirrhosis, that's when you see people having huge abdominal swelling, and sometimes they will be vomiting blood, they'll have leg swelling and the rest. So if it is not properly treated, it can also lead to cancer. So, but how do you treat hepatitis B? It is important to know that if you just go to the lab and they test and they say you have hepatitis B, don't just start treating right away. There are things, there are investigations that you need to do. And one of the most important investigations that you need to do is to check the amount of hepatitis B virus that you have in your blood. That's the viral load. If the amount of hepatitis B virus is small, there won't be any need for any treatment. Secondly, you do liver function test to see if the hepatitis B virus have damaged the liver. If there is no evidence that the hepatitis B has damaged the liver, there won't be any need for treatment. Also do scan to see the structure of the liver. If the hepatitis B has damaged the structure of the liver. If there is no damage, then there won't be need for treatment. But if it fulfills the criteria, your doctor, the specialist, will give you treatment to reduce the amount of the virus and to try to limit the damage and, if possible, reverse some of the damage that has been done. But the problem is that most people will just be giving treatment just like that, and that will do more harm than good because you do not know where you're starting from. If you have hepatitis B, please do not allow anyone that is not a specialist to treat you. See a specialist, do the necessary investigation to see if you need any treatment. But for those who have screened themselves and they don't have hepatitis B, it is very important that you vaccinate yourself against hepatitis B because hepatitis B viral infection is totally preventable.